Everyone, myself, Dr. Sonal Thakkar, working as an assistant professor at Ahmedabad Physiotherapy College, welcomes you all on behalf of Parul University. Now I am going to introduce you our webinar's resource person, Dr. Khushbu Thakkar. Dr. Khushbu Thakkar has graduated with a bachelor degree in physiotherapy from Metas of Seventh Day Adventist College, Surat Branch Campus, University of Manipal Academy of Higher Education in the year 2007. Further, in 2008, he joined Master of Physiotherapy in Obstetrics and Gynecology at SRM College of Physiotherapy, SRM University at Chennai, Tamil Nadu, and passed as gold medalist in 2010. She has more than 10 years of experience in the field of women's health. She has helped several women at the time of labor and uh, thereafter has her own private setup in name of Saki Women's Health Physiotherapy Clinic in Surat, which is exclusively a women's health center. She has conducted seminar on labor, postpartum, physiotherapy in gynecological condition at hospital setups, and now I request Dr. Khushbu Thakkar to share her knowledge.
Thank you, Dr. Sonal, for giving such a warm welcome and a great speech. First and foremost, I would like to thank Parul University for inviting me as a guest speaker for this beautiful topic of exercise and PCOS. And as you've already introduced me, I just do not want to waste any more time and we'll directly start with our session. That is what we are going to discuss today is basically exercise and PCOS. Okay. So I'm just going to walk you through that what am I going to talk about like in this 1 hour, in this coming 1 hour. So what is the highlight of the entire webinar? I'll just give you the key points and just try to stay with me throughout. If there is any doubt or you're not understanding what I'm trying to say, you're most welcome to ask questions, maybe in between or after the session, anything is welcome. So, before we start with the thing that why exercise is important or what kind of exercises has to be done in PCOS, it is very, very crucial and important to understand what PCOS is. So, we're going to talk about PCOS as the main definition of PCOS. What is the manifestation or what are the signs and symptoms? As it is a syndrome, we definitely will be having a lot of signs associated with the symptoms that will be there in this condition. Then we'll be talking about the diagnostic criteria. How do we label a woman who has PCOS? Because there are a lot of differential diagnostic things that has to be taken into consideration. We will be discussing about the four main features that normally happens in a PCOS woman, depending on the diagnostic criteria, definitely. We'll be talking about different types of PCOS, which is just for a general information, because when we'll be seeing women with PCOS, it is mandatory that we have a good backup knowledge about what exactly and how many different types of PCOS a woman can present with. All right, after discussing about the four manifestations, which we are going to talk about that in detail in the first half, then we directly jump to our exercises, like what kind of exercises will be given, what should be the intensity of the exercise, what should be the duration of exercise, what are the benefits of exercises in women regarding PCOS. So that is what we'll be ending our session with. I hope I have made myself clear. I highlighted the points which I'm going to talk about. Now we'll start with the main thing, that what exactly PCOS is. So the full form of PCOS is polycystic ovarian syndrome. Now, the name over here is a little misleading because when we say PCOS, the first image that comes in our mind is some ovary which has a lot of cysts in it. So there is this the name of this entire syndrome is a little misleading because any woman who has been labeled to have PCOS does not necessarily always have to have polycystic ovaries. If she's just having polycystic ovaries, it is called as PCOD. It is called as polycystic ovarian disease. But when other criteria of the diagnosis has been met in PCOS, in the PCOS criterion section that I'm going to talk, then only we can label her as PCOS. So what thing that has to occur into mind or what image that has to come into our mind when we talk about PCOS is that it is just not the polycystic ovaries, it is just not the male hormone, it is just not some disturbances in the body. Basically, it is a very, very complex thing that is happening in the body. And the basic or the main thing that is the key thing that is happening over here, it is basically an endocrinopathy. There is a hormonal imbalance in her body, especially happening in her reproductive age, and which is one of the most commonest or the leading cause of anovulation, which is resulting into infertility in these women. All right, I go again. It is an endocrinopathy, which is basically recognized in the reproductive age of a woman, which is one of the most leading cause of anovulatory or oligoovulatory infertility. The manifestations we'll be discussing when we talk about the diagnostic criteria. Before that, coming to the major comorbidities, I'm going to talk about the three main diagnostic criteria by universal bodies that is globally accepted. The two most commonest which are used by the gynecologists will be, which was first pointed out in 2003, that is by Rotterdam, which says that there are three things that will happen in a PCOS woman. One is oligo or complete anovulation. Oligo means ovulation is happening, but not as per what is expected, that is every month. Second, there can be clinical or and biochemical signs of hyperandrogenism. Hyperandrogenism is nothing but that the male hormone in a woman's body is more than expected. That is why it is hyperandrogen. Androgen is a male hormone. There are different types of androgens, testosterone, then DHEA, different types. But all the male hormones or a particular type of a male hormone, when it is elevated in her serum, that is in the bloodstream, or if she's having, if she's having a clinical presentation of the male characteristics in her body, that are the symptoms that are going to be seen on her face, on her chest, or that we talk like baldness in the baldness, or all these kind of symptoms, that is called as hirsutism. That is a clinical hyperandrogenism. And the third thing is polycystic ovaries. According to Rotterdam, two of these criteria should be met. So it is possible that she is not having polycystic ovaries, but she is having the first two criteria met, and then two, she is PCOS. So as I already said that the name is misleading. So a woman with PCOS might not have polycystic ovaries, but might have oligo and or anovulation. And the second criteria is hyperandrogenism. There is another society which has given criteria, which is Androgen Excess PCOS Society, which was done in 2006. They have only given two criteria, and both the criteria has to be met. So this is what they have mentioned. The first criteria is clinical, that is hirsutism, having male characteristics, or and either ways, biochemical signs of hyperandrogenism. Second, ovarian dysfunction, that is oligo or anovulation, again, and or polycystic ovarian morphology. Either of the, both of these criteria has to be met to label a woman PCOS woman. As I said, name is misleading. It is basically an endocrinopathy. The hormones are a mess, and there's a lot of havoc that is happening inside her body, which results into a lot of metabolic disorders. If we know our body well, we understand that each and every function of our body, there are some hormones which has a nice interplay, which is working in a very beautiful synchronized manner so that all the functions happen the way it is supposed to happen. When they do not function in that way, when there is some pathology behind, called as endocrinopathy. And over here, your ovarian hormones are the ones which are not, having the correct pulsatile release of the hormones, which is resulting into some kind of dysfunction, which is what we are going to talk. So I've discussed about what is PCOS. It is a syndrome. We are going to now talk about the major manifestations. We have talked about the diagnostic criteria by the two universal bodies, and how do we have to meet those criteria to label a woman as a PCOS woman. Okay. Because of lot of information that has been given, and lot of people are talking about PCOS. It is very common for most of the girls in a younger age, maybe in her adolescence, or maybe in that age of 20 to 30, that is that decade. They self-diagnose themselves as PCOS, and there is this major concern of infertility in these women, because there is a lot of information available on the social media or on the internet. It is very easy to diagnose our own self, and again, half knowledge is dangerous. So it is very crucial to understand this thing, that any woman should be labeled PCOS only when other hormonal disorders has been ruled out. There are few disorders I have mentioned over here, which needs to be ruled out. There are differential diagnoses for PCOS because these are all hormonal imbalances. Once that has been ruled out, and then if we do not have anything, and if the criteria has been met for PCOS, only then we label a woman as PCOS. So this is a unanimous agreement from the research bodies that PCOS has to be a diagnosis of exclusion. Just because you have hirsutism, that is male kind of characteristics, just because you have PCOS, just because you have PCOD, that is polycystic ovaries, it doesn't mean you have PCOS. Just because if you are having menstrual dysfunction and maybe hirsutism, it is not necessarily always that you have PCOS. So it is not A is equal to B means B is equal to A. Maybe if you are having hirsutism, polycystic ovaries, and some biochemical markers that are present, it is definitely, or it can be PCOS. But this does not mean that this is there. All right, so it has to be a diagnosis of exclusion. You have to rule out few things, only then come to the conclusion of having PCOS. The most interesting thing over here, this is the sixth point, that is a functional hypothalamic amenorrhea, which is very commonly seen in young girls, and which I have also come across many girls having this dysfunction. So what happens over here, your hypothalamus does not, the hypothalamus pituitary axis, if we are aware about it, they are the two they are the two structures which are regulating the hormones in the rest of the body. Okay, so this hypothalamic pituitary axis gets a little confused because of certain changes that a woman makes in her life. If she's if she's doing intense exercises, or if she's having this intense, body image issues. So if you see people who are anorexic, who just don't eat because they fear of the fear of getting fat is there, that is going to have a tremendous effect on your hypothalamic pituitary axis, which might result into functional hypothalamic amenorrhea, that is FHA. This FHA has a lot of symptoms and signs which are very similar. They are going to mimic PCOS a lot. So we need to rule out, obviously, we are not the ones who are going to diagnose PCOS, but we need to have a little bit of knowledge, a backup plan when we know that these are the things which can happen. So when we see people around us, maybe our sisters or maybe our cousins or whomsoever, wives or who might be suffering from PCOS, we need to find out, make a flowchart that whether it is really PCOS or not. And the other ones are all hormonal disorders like thyroid disorders, hyperprolactinemia, congenital adrenal hyperplasia. These are just to name a few. As I already mentioned, we'll be talking about the other thing is the types of PCOS. So basically, there are four types of PCOS, polycystic ovarian syndrome. Before actually jumping into whether you are having PCOS or not, we have to find out whether it is yes or no. If it is not PCOS, then you have to treatment plan will vary depending upon whether it is PCOS or not. Once we come to know whether it is PCOS, we need to find out what are the different types. The first one which is mentioned over here, the one who has insulin resistance. If it is because of insulin resistance or because of PCOS, there is insulin resistance. It can be either ways. Then it is called as insulin resistant PCOS. If it is not insulin resistance, it can be because of pill. There are certain pills or maybe birth control pills or certain medications because of which there can be higher level of androgen that is produced by the ovary, and that might result into PCOS. Okay, so it is transient, maybe it is temporary. So that kind of PCOS is called as post-pill PCOS. Then there is third, which is because of chronic inflammation. Again, the cause over here we don't know, but because there is chronic inflammation, again it results into a array of movements in the body that is going to cause PCOS kind of symptoms, and that is resulting into inflammatory PCOS. And the last one is it because of androgen? It is DHES the only androgen which is elevated? Then if that is the case, it is called as adrenal PCOS. All right. So we need to have a little bit of information about different types of PCOS. Now, as we are talking about different types of PCOS, I would like to add one more point over here. There is also something called as lean, LEAN, lean PCOS. Again, our brain is very smart. When we talk about PCOS, the first thing which comes into our mind is a woman having maybe unwanted areas in which the hair pattern is there. So maybe facial hair or hair on the chest, hair on the back, maybe a little bit of baldness, thinning of hair, a very obese woman, male kind of characteristics in her. But this is not always the picture a PCOS woman will present with. There is a possibility that the woman might be lean, she might be really thin, might not be having a lot of male characteristics, but still she has the diagnostic criteria met. So the symptoms से भी ज़्यादा signs are more this they are the more diagnostic thing for which we can say that she has PCOS. Rather than just seeing a woman and labeling her as PCOS, we need to see the signs, the criteria which I have already mentioned has to be met to be labeled as PCOS. So these are the symptoms. These are a very broad spectrum, a very broad classification of symptoms that have been mentioned. But as it is supposed to be told, because we are talking about syndrome, we need to talk about the symptoms also. So there can be irregular or no periods at all. Second, excess hair growth on face, chest, back. Acne is one of the symptom of PCOS. But because someone has acne, it's not necessary it is PCOS. Hair loss or thinning, that is balding. Weight gain or trouble losing weight, that is one thing. If it is just that she's trying everything but she's not losing weight, that is also one of the symptom of PCOS. Dark patches on skin, which is another symptom of the of people who has diabetes mellitus. Anxiety, depression, it's not a straightforward thing over here. It's There's a lot of complex things happening in the body which might result into anxiety, because it is very important that a woman in this era where social media is in full bloom, everyone wants to look good, everyone wants to be thin, and when someone is having dark patches on the skin, unwanted facial hair, definitely there might be some or the other, especially in younger girls, there can be some or the other things which is going on in the mind which might result into anxiety, that anxiety of infertility, whether I'll be pregnant, whether I'll become pregnant or not, whether everything will go well or not. So it and depression is a very serious condition which we cannot just label very loosely. It's also to be it's a clinical thing. It's clinical depression. So this is also in extreme cases it can happen. Infertility, definitely, because of anovulation or oligoovulation. Infertility is one of the byproduct of PCOS. All right. So these are the symptoms. And in the picturesque representation, you can see that excessive unwanted hair growth, irregular periods, as I already mentioned, acne, hair loss, thinning. Insomnia is also one of the symptom of this, because you're constantly anxious at what is happening, what will happen. Another comorbidity or another thing which is a byproduct of PCOS is diabetes mellitus 2, which we'll talk when we talk about insulin resistance. Okay, so this is another pictorial representation of the symptoms that we just mentioned. Now, coming to the cause, we have talked about that this will happen in PCOS. Now, the next question that comes to our mind is that why is this endocrinopathy thing happening to a woman? Okay, the cause, the etiology. Everything is associated in our body to our genetics also. Recent researches or the study which has come up, they have found out a PCOS gene which is being passed on from the mother to the girl, to the baby girl, and that expresses itself, and she might have this endocrinopathy. Now, the interesting thing is not just the gene. The interesting thing is that why does it express itself? So, you might be having the PCOS gene, but it is in the recessive state, it is not coming into the dominant or the fulminant state. And only in few women it becomes dominant or fulminant, and there are factors associated with it. So that is what the study, that why the gene expresses itself, the study is called as epigenetics. Over here in this women, we have found out, the researchers have found out that the gene expresses because of two major contributing factors. One is a diet, and second is the environmental factors, which will just give you a brief idea that how exactly there is interplay of this expression of the gene. All right. So it definitely is going to, the choice of a diet and the type of a lifestyle definitely has an impact over the genes. It can be for better or for worse. Over here in PCOS, obviously it is for worse, because it's an ugly syndrome which comes out of it. Stress, again, it's a lifestyle disorder. Stress, it can be in any form. It can be physical stress or it can be mental stress. Over here we talk about mental stress more, because physical stress is not what we go through a lot these days. And the last one, there might be no genes, there might, the lifestyle is absolutely okay, no bad dietary choices, no stress, nothing, but still it is there. So that is where it's beyond our understanding. So it is idiopathic. We just don't know about it. Yeah, this is one thing which we need to understand when we talk about PCOS. So it is not just that fat woman having male kind of characteristics, having unwanted facial hair, baldness, coarseness in her voice is what we have to think when we talk about PCOS. There are four things which has to occur into our mind when we talk about PCOS. First is insulin resistance, which has to be the primary, which is one of the most common finding, or one of the most 70% of the women, I would put it in the other way, 70% of the women who has PCOS will be having insulin resistance. All right, so it more or less plays a central role in PCOS. So I'm going to talk a lot on insulin and then the other hormones, of course. But the insulin resistance is one thing which has to occur into our mind. And what are the effects of insulin on the rest of the body, insulin resistance on the rest of the body? That has to occur. And then how are we going to treat that? That is what we are going to talk. Second thing which happens is high androgen levels, hyperandrogenism. That are the criteria which we have discussed. Third thing is high level of leptin, which is not mentioned over here, which is again what we are going to talk about. Higher levels of cortisol, which is a stress hormone. And last but not the least, because it is endocrinopathy, so all the hormones are not in the right amount, or maybe they are beyond the amount, but the body is not reacting well to the amount of the hormones that are released. So that is what is happening. Because of all these things, there is going to be chronic low grade inflammation inside the body, inside, internally, on the organs, at the cellular level, and how it is going to affect the body is what we're going to discuss in another 15-20 minutes before we start with the exercises. So my first thing, which I already said, insulin resistance. Before we know what is insulin resistance or what is insulin sensitivity, we need to understand what does this insulin do in our body. Insulin is a hormone that is produced by the pancreas, which we all know. This insulin hormone has one very, very important characteristic or very important function, I would say. That is, it is regulating your blood sugar level. So when we eat food, so the level after the food is getting metabolized from the different components that we have eaten, the carbs, proteins, lipids, and the sugar, the blood glucose level, when it rises up in the body beyond a particular level, this insulin hormone is signaled by the brain that the blood sugar level has, it's rising. You have to come into picture and take this excess blood sugar, divert it into two different places, that is into liver and the muscle, and store it into glycogen. Okay, so it is just stored. After the liver is saturated with glycogen, it is saturated with muscle is saturated with glycogen. Insulin does this work of changing the excess glucose into fat. It is converted into fat. Getting it? So it is basically shuttling the sugar. It is obviously the sugar that is there in the blood is being constantly utilized as fuel, and the excess sugar that is there, it is stored in the liver and the muscle as glycogen. It also signals the liver to stop to stop the more of glucose production, because glucose is already high in the bloodstream. Second important function that this insulin does is it also acts on your fat cells. It also acts in synthesis of fat. When high insulin is there, it will also result into higher production of fat. This thing you have to remember, because this is what is important pathophysiology when it comes to PCOS. So what happens in insulin resistance? In insulin resistance, your body is not following the signals. Your brain is trying to produce more insulin because there is more sugar that is produced. But that insulin, which has to shuttle the glucose into glycogen, is not happening. So there is going to be more built-up of sugar in the blood level. And that is why that is going to result into more insulin production, because your brain doesn't understand that blood glucose is not getting converted into glycogen. That is what is the pathophysiology. So again, more insulin is produced, so more sugar, more insulin, more sugar. So this is like a vicious cycle. Because there is higher level of blood sugar, there is a higher chances of diabetes mellitus type 2 in these women, which is a comorbidity. Now, this excess insulin just does not act on the blood sugar level. It has one dirty effect on the ovary, because ovary is also another gland like the pancreas, which is producing female sex hormones as well as male sex hormones. Now, when this insulin is high, and the body is not responding to it, that means it has become resistant to the secretion of insulin, it signals the ovary to produce more of male hormones, which is just not by insulin, but more of luteinizing hormone from the brain, from the pituitary. Okay. So there is more of male sex hormones that are being produced by the ovary by a specific cell, which is called as the theca cells. So excess of male hormones are being produced under the influence of excess insulin and excess luteinizing hormone, LH. Second thing which insulin does is it will decrease the production of SHBG, that is sex hormone binding globulin. Now, what does this SHBG do? It will go and attach to the excess testosterone and it will just curb its utility. Okay, so the thing is, when insulin reduces this SHGB, there will be more free androgen in the ovarian environment. Little bit of androgen is okay, but when this androgen excess happens because of excess insulin, that is insulin resistance, plus SHGB is also less, so there will be more free testosterone, more free androgen in the ovary. As ovary is a female reproductive organ, we need female reproductive hormones rather than male reproductive hormones. So when the male reproductive hormones are more than a particular level, it is not going to let that female reproductive organ do its function of ovulation because it's an androgenic environment in the ovary. Okay, so definitely it is going to affect the ovulation. It is not letting the follicles mature and ovulate as it is supposed to happen in a menstrual cycle. So that is why there will be multiple small follicles which are not maturing into a dominant follicle which has to rupture and the egg is released, and that is what is causing ovulation under the surge of luteinizing hormone. Surge means a peak, excess peak of LH. Again, there is a very good, there is a lot of hormones are playing over here, the gonadotropic hormones, that is FSH and LH. There is an interplay of these two hormones which has to happen in the cycle for this entire process to happen. And that process is disturbed by this insulin resistance. So this is the effect of insulin on ovary. All right. So as you can see, insulin resistance can be because of obesity and inactivity. They go hand in hand. Genetics, as I already mentioned, it can be because of aging. There can be some dysfunction. Medications, definitely. There can be certain rare disorders which might result into insulin resistance. Now, insulin resistance can cause PCOS, and PCOS is going to again, perpetuate insulin resistance. It's going to make the symptoms of insulin resistance higher, or it's going to get more worst is in this kind of bill. All right, and because of insulin resistance, definitely you can have type 2 diabetes, PCOS, atherosclerosis, dyslipidemia, and hypertension. Because as I said, there are two functions. It does not only count on the blood sugar, but it also promotes the synthesis of free fatty acids. That is what insulin does. So when your brain is producing more insulin to take up the blood sugar को नीचे करने के लिए, पर वो उसके साथ साथ with that this insulin is also increasing the level of fat in the body. All right, free fatty acids are released in the body. That is why dyslipidemia, because of insulin resistance, and that is why atherosclerosis. All right, so this is what we talk about: insulin on ovary, insulin on fat. Why does this insulin resistance happen in PCOS in first place? First thing we already mentioned, it can be genetics. And second thing, what we were talking about epigenetic is the environmental impact, that is the diet and the lifestyle. First thing we are going to talk about the diet. When a woman is making bad dietary choices, having junk food, having artificial sweeteners, what exactly happens inside the body? These artificial sweeteners basically are not metabolized well by the liver. Their body is confused with this artificial sweeteners and it takes this fructose. It is called as high level of fructose. This is just one example which is used in the processed food and the drinks. They are called as synthetic sweeteners, which gets it in the liver. This fructose is not metabolized and it gets converted into fat. When the liver is having more than 5% of fat in it, it is called as fatty liver. Now the liver is not able to take that much of fat. So it is going to just release that fat into the bloodstream because it is not able to metabolize it. So what happens over here? Because of that excess fat, excess overload in the liver, it is going to release it. And once it starts releasing into the bloodstream, it goes and clogs into different cellular level and at the organic level, because of which your organs feel damaged, stiff, and that is why a process in the body, because of any damage or harm that is there, which your body perceives, it is going to result into some sort of inflammation. It's a natural response of our body to harm. So that inflammation, if it is for a very long period of time, it results into chronic inflammation, which has its own other side effects. But this inflammation again has a cyclic effect on the insulin. It is going to inhibit the insulin signaling, or the insulin sensitivity is going to reduce, and that is what is going to result again into insulin resistance. So maybe the start point is insulin resistance, or the end point is insulin resistance. Ultimately, everything is going to end up into insulin resistance. This is a vicious cycle. We don't know where exactly it is starting from, whether it is genetic or lifestyle. Ultimately, there is going to be insulin resistance in PCOS. 70% of the women will be having it. Maybe 10, 20, 30% might not have it. Because of this hyperinsulinemia, I have already talked about it on the ovary, which is going to cause hyperandrogenemia. And because again on the pituitary, it is going to increase the luteinizing hormone, which is again going to act on the ovary, again going to result into hyperandrogenemia. Because of high androgen level in a woman's body, it is going to release the fat in the bloodstream. Like the liver, as it is not able to metabolize more than 5% of the fat in its cell, it is releasing the fat into the bloodstream. The excess of androgen level in a woman's body has its effect on the adipose tissue in the body. Okay, so it is going to release the free fatty acids into the body. Again, when the free fatty acids, as I already said, that chronic inflammation, and it is going to reduce the insulin sensitivity, it is going to have its effect on the insulin, which is going to increase the insulin resistance. This is just the theoretical explanation of the diagram. Okay, so this is just to explain that how a bad dietary choice might result into PCOS. So more of sugary content, artificial sweeteners, it has a direct effect on your insulin, which might result into insulin resistance. Insulin resistance has its ugly effect on ovary by producing more of those male hormones. That is, testosterone is just one of the male hormones. When there is more of male hormones in a woman's body, it is not going to let the ovary function the way it has to function, because it's a female reproductive. That will result into those polycystic ovaries, which is one of the criteria to be met for a PCOS woman. So we have talked about insulin's effect on ovary, insulin's effect on fat, insulin's effect on liver, and how all these things, when they go into a vicious cycle, is not going to do anything but going to increase the insulin resistance. Then we talk about the lifestyle. Second thing is lack of sleep, stress. It is all going to increase your level of cortisol hormone, which is a stress hormone, which is produced by the adrenal gland. Cortisol is just not the stress hormone. There are other hormones as well, but cortisol is markedly elevated in a woman with PCOS. That is why we talk about it. As I told, that there are different hormones which are going to have imbalance. There is going to be pathology in these hormones. First was insulin. Second, I told, was leptin. Not only insulin is getting resistant, there is this another very important hormone which is called as leptin, which is going to get resistant in PCOS people, females. So leptin hormone is, again, what is the function of the leptin hormone? To understand what is the dysfunction, we need to understand what is the function of this hormone. The function of this hormone is to have a satiety level. Satiety means when we eat food, after a particular point, we feel that, okay, my hunger is, I've had enough food, I don't want any much further. So that is basically done by this hormone, that is the satiety hormone. Okay, it is released when there is good amount of fat in the body, or the normal amount of fat in the body. Okay, it is not only released by the fat cells, but it is also released by your ovarian cells. It is also released by one of the layer of the ovary. Okay, so again, everything is interrelated. Then in this process, we have another hormone which is called as ghrelin, which is a hunger hormone. It is an intuitive way of our body saying that I'm feeling hungry and I'm done, I'm full. So these two hormones have to work on and off to control the feelings of hunger and fullness. When these two hormones are doing its job well, then there is no such problem of having, eating excessively in spite of being full, or just not eating, or the other way around. So this is how the balance is there. If it's a pictorial representation, when there is hunger, there will be more ghrelin because that hormone is being produced, and leptin is less. And exactly the opposite happens after eating. There will be less of ghrelin because the hunger has been, the satiety has been maintained. So the leptin will be more. So the brain is signaling that no more food is needed now. I'm done. I'm full. This balance is definitely interrupted in PCOS women. Again, causative factors, it can be genetic, it can be environmental, or it can be unknown causes or stress related. Now, lack of sleep, stress related, which I'm talking. What happens over here? More ghrelin is released. So the female feels hungry all the time and it lowers your leptin level also. So there'll be craving, especially for quick sources of energy, which is high in sugar level. When there's high in sugar level, as I already had this pictorial representation of those that candy and how it acts on the insulin. So high blood sugar level has its effect on the insulin, high body fat, of course, and that results into insulin resistance at the end. So leptin goes resistant in the body. Leptin is being produced more because it is more adipose tissue in the body. So more leptin is being produced in the body. Ovary is also signaling to produce more leptin to give that feeling of fullness. But there is something which is faulty. There is some mechanism which is not letting leptin do its work. So more leptin is produced because of more fat, of course, but it does not work as it has to. So body is insensitive. It is just not, not following the signals or not just doing the right thing that to the rise in the leptin. That is what is called as leptin resistance. So there's always a feeling of hunger as satiety hormone is not functioning well. And because that hormone is more adipose collection is constantly there, which is again going to cause more insulin resistance. So we eat, fat gets stored, fat cells secretes more leptin, brain sees increased leptin. Now there is a fault. Over here, increased leptin is not signaling to stop eating. So it has a detrimental effect again on the ovary. Leptin is just not causing this, as I already said, it's also released by the ovarian hormones. So what does it do? What does leptin do on the ovary? This leptin hormone has its effect on the GnRH, that is the gonadotrophin releasing hormones from the hypothalamus, and thereby it has its effect on the pituitary, anterior pituitary, because hypothalamus pituitary axis. Because this higher level of leptin is being released, again it is also released by the ovary. It has its effects on GnRH. It has its effect on the hypothalamus, on the GnRH of hypothalamus, then on the pituitary. And this pituitary is doing, these GnRH are two hormones, FSH and LH. It is produced by the granulosa cells of the ovary. Because of this increasing level of leptin, the FSH which has to increase initially, and once the can you hear me?
Yes, ma'am.
Just a second. I think my laptop got disconnected.
Yes, ma'am.
Okay. I hope we can see the presentation now. Sorry for that. So the leptin has again a ugly effect on the ovary, and it is definitely going to affect your ovulation. So the insulin resistance and the leptin resistance has its effect on the ovary regarding the ovulation. So this is the pictorial representation of how leptin is going to act on the ovary and how excess leptin, resistant leptin, how it is going to act on the ovary by acting on the hypothalamic pituitary axis, and what is it is going to result into hyperandrogenism, hirsutism, and ovulation, and otherwise. Third thing is the lifestyle, which we're talking about, the causative factor for PCOS. One of the factor is lack of exercise, not only stress. We all know that the lack of exercise is definitely going to have a lot of impact on the body. We being into this field as a physiotherapist, we constantly talk about the benefits of exercise. So definitely we understand that if a person is completely sedentary, is just not doing anything, is making bad choices not only regarding diet but also regarding the physical form of exercises. So many people have this confusion about that they are active at home, they are doing the daily functional activities, but if they are just not doing, just not taking out at least half an hour for some form of activity in their life, some form of exercise in their life, that is not going to help them in the longer run. There's something called as physical activity in which you're active and doing your functional day-to-day life activities. But if you're not having anything to be done in the entire day as a form of exercise, it is not necessary that you need to go to a gym or you need to do something like, hit a gym and do 1 hour of strength training. But you need to have at least one form of exercise in your day-to-day life as to be labeled as a physical exercise. So definitely lack of exercise has its effect on PCOS. It has been found out that even a few minutes of exercise a day, we are going to talk about what kind of exercises, is definitely going to help curtail the symptoms of PCOS. Cortisol, which is one stress hormone, which I already said, it has a massive effect on the body weight, especially on the stomach fat. It is produced by the adrenal gland. And what is it released by? Stress. It can be physical stress or mental stress. Again, when there is increased level of cortisol, it is going to increase your stomach fat, that is the fat level. And because of that, it is also again going to increase the cortisol. Again, insulin and cortisol, they are partners in crime. Both of these hormones, they work in, they work in synchrony with each other. When there is higher level of cortisol, there's going to be higher level of insulin and vice versa. And both of them is going to result into accumulation of fat, especially at the base. Okay, so we have discussed about the entire pathophysiology of PCOS. This is what I was talking, the highlighted point. We just took 5-7 minutes extra, but we'll cover it up, doesn't matter. A woman who goes into a gynec's clinic and she has been told that she is having PCOS, so reduce weight, eat healthy, and do this, do that, go search internet. This is a very, very vague information for a young girl. So we, as a medical professional, we need to be very, very, you know, aware about what exactly is happening over here and how do we deal with it. So just this information of eating less and working out more will not help. So this is what is one thing which has to be kept in our mind so that we can explain it to our client or our patient in a better way. What kind of exercises can we give for a PCOS woman? As any shoulder patient or any patient who has knee pain, not all patients will be having the same kind of exercises. Similarly, any woman who has PCOS, not all of them will be having the same kind of exercises. So it is no one size fits all. You cannot generalize any form of treatment to everyone. You have to customize your exercise regimen, and it has to be done by a nice trained professional because you need to understand the pathophysiology to actually give them a protocol. Regular exercise is the key, definitely. Lifestyle modification is one thing which need to inculcate into their mind. What are the benefits of exercise? As we talked about the insulin resistance, the leptin resistance, how is it increasing the hyperandrogenism, and because of which how it is affecting the ovary and the ovulation. Your fat is increasing because of the bad dietary choices or because of genetics, we just don't know, and how the entire body composition is changed. So one thing which we need to understand over here as a professional is that being healthy doesn't mean that you are low on weight on your weighing scale. There can be people who will be extremely thin, but there is a havoc inside the body. As we already mentioned, there can be people who might be having lean PCOS. So it is not always about losing those extra weight on the weighing scale. It is about being fit and more healthier. So how exactly do we define health and fitness is what is what we have to perceive and just give the right kind of information to our clients or our patients. All right. So the body composition, it means that your body is made up of a lot of things. It is made up of fat, it is made up of muscle, it is made up of water, it is made up of bones. And each of these things is comprising of some amount of weight or mass, which is the entire byproduct is our weight or the mass that we are holding, right? If your muscle is higher in your body, your muscle content is higher in your body, your weight is definitely going to be slightly on the higher end because your muscle is a metabolically active tissue and it is more of a consistency of steel. This is just an analogy. All right. Whereas fat, if you compare, it is basically a metabolically inert tissue. It is more like cotton in the body. So you might look thin, but your fat content might be higher and you might look bulky, but your muscle mass might be. So body composition is a very, very important concept. It is just not being on the weighing scale throughout the day or every single day, which is going to give you a parameter of how healthy or fit you are, which is what has to be taught to your patient or client, that it is important that your muscle mass should be more. All right. Not only the muscle mass, everything has its own function, but it has to be in the right amount in proportion. What kind of exercises are going to help? So this is this is the message that I want to give. What kind of exercises? So most of the women which we see, like, especially the middle-aged women, they feel that going out and just having a walk is going to help. And it is just going to make them fit throughout. Rather than doing nothing, at least a walk is better. I understand. That is definitely a good thing to do. But just walking, just cardio activity is not the right exercise for a PCOS woman. You can ask her to do cardio, but if she is doing cardio daily, it is not going to help her in the longer run. So there are three things that has to be taken into consideration. One is strength training. Second thing is high intensity interval training. Third is yoga or any form of relaxation, meditation exercises. And the fourth thing is, so we can also talk about Pilates, the core stability and being physically active as well. So if you are waiting for someone to ring a bell and open the door, I mean, someone is there constantly working on your behalf. You're just sitting from 9 o'clock in the morning till 9 o'clock at night, food is coming to your table. You're just not doing anything. That is that you're completely physically inactive as well. You have to start from there. All right. So that is why it is customized. Depending upon who is coming to you, what is their level of activity in their day-to-day life, we start from there. All right. That is why we cannot generalize the treatment. I'm going to talk about why strength training, why high intensity interval training, and why yoga. Strength training looks like this, but not necessarily you need to carry heavy weights all the time. You can start with your body weight. Again, that's just the beginning. Then you can go and take higher weights to increase your muscle mass. Why muscle is important over here? Why do we want to build muscle in these women? Because muscle is a metabolically active tissue. All right. First, because it is active tissue, it is just not going to stay in your body and not do anything. In this body, in this house of ours, muscle, when it is as a tenant, it is very expensive tenant. It is using the resources of the house. It is burning fat. It is burning calories. That is why it is called as metabolically active. Whereas fat is a very lazy tenant. It does not require other resources of the house to be utilized. So when the muscle mass is increased, it is going to definitely help in burning fat, burning calories, and because it is metabolically active, it is going to rise your BMR, that is basal metabolic rate. Definitely, it has a direct effect on the insulin. When the muscle mass is increased, it increases the insulin sensitivity. The uptake of the glucose by the muscle is going to increase. So definitely the area of events that happens because the insulin is getting resistance, we are trying to reverse it a little bit. Okay. And another added benefit of doing strength training, it's by just study or a journal of sexual medicine. It increases the libido, better quality of sex, less anxiety, depression, which are the byproducts of a woman who has PCOS. Okay. Now the Next question, that how much weight should I lift? Or should I start with lifting weights straight away? Again, it has to be customized. It cannot be a generalized. Obviously, weight should be there, and the weight, the type, quantity of it, or the how much weight should be given, is what we studied. What as a physiotherapist we study in the first year, the RM, the maximum repetition, and how much weight has to be given according is based on that. So if a woman is able to lift 5 kg and is able to do the bicep curl full range without faltering, without doing any trick movement, and she's able to do it maybe only once, then that is her maximum capacity of taking that weight. All right, so we start with a little lower weight. So we decide the RM, and then we have to design a protocol for her for the rest of the body as. It should not be so heavy that she cannot complete the rep safely and in a proper form. It should not be so light that she just does not feel that I'm lifting anything. So the right amount of weight with the proper form and technique is important and needed. How many days would you recommend a woman to do strength training? 2 to 3 days. 3 days, fair enough. And if that is not possible for her, at least motivate her to do it for 2 days. 2 days, so initially, when you are at the beginner level, you are not going to maybe divide it into 3 sectors. If you are a gym goer or if you have been doing strength training for a very long period of time, we understand that strength training is not done for one part daily. You have to change it. If one part of the body, if we are doing a strength training, a good vigorous strength training, high core strength training, then that part will come next week. So normally if you are at a intermediate or a higher level of strength trainer, your body parts have been divided. It is divided into lower body, it is divided into chest, shoulder, triceps, and back and biceps. And one day will be abs. So basically they do 4 days of strength training. Abs can be included with some of the other this. So 3 days basically. All right, but that is at the higher level. If you are at the beginner level, we are not maybe start with lifting weights. We can just start with body weight, and there's no need to divide over there. You can go for a whole body approach. Slowly and gradually, we divide it into 2 parts and then into 3 parts. All right, so not more than 2 to 3 days a week. Otherwise, it is going to result into excessive soreness or injury. High intensity interval, a very good concept. All right. Why do we have to go for a high intensity interval training, and what exactly is HIIT? It is commonly and popularly called as HIIT, HIIT. This is going to be a short and an intense bout of exercise, a planned exercise, and intermediately in between there'll be periods of rest. When you are going for an intense kind of exercise, your body does not have sufficient time, the oxygen in the body does not have sufficient time to metabolize the fuel and give it to you, which is happening in our cardio, aerobic form of exercise. Over here, when it is intense, high burst of activity, it is basically anaerobic form of activity. Over here, anaerobic itself, the name itself suggests that oxygen utilization is not happening over here. So whatever is stored in the body, which is kept as reserve, is quickly given to the body to be used as a fuel, as a substrate. Okay. Now the body is very intelligent. It is not going to leave that thing that you have used. Because you have used the reserve, it is going to ask you to repay. The debt has to be clear. So when you are in the recovery period, after the activity is done, after the HIIT workout has been done, your oxygen consumption, that is what it is, this concept of EPO, that is excess post oxygen consumption, post exercise oxygen consumption, is what is happening over here. So you have to repay the debt by breaking down the fat content in the body and restore the fuel which was used by from the reserve bank. All right, so that is happening in the next 48 hours, that epoch. Okay. Again, it should not be done more than 2 to 3 times a day. I would suggest not more than 2 days. Again, it is going to have a lot of it's a very high intense workout. It's going to increase your heart rate level to a very high level. Again, when you are giving someone high intensity interval training, please check the fitness level of the patient. So if just do not keep it like, because PCOS high intensity, so a woman comes to you for PCOS and you directly shift her to high intensity the second. She might just not able to cope up with it, and she might result into some bad, some sort of dysfunctions, or we just are not aware what can happen. So be very careful in designing your protocol over here. During this intense interval, your muscle is losing a lot of glucose. It is using the reserve basically. So this is just the pictorial representation. Here, the body is moving in and out of the anaerobic state in HIIT, and it is using the reserve anaerobically rather than aerobically. That is excess post oxygen consumption, which I just mentioned. To clear the debt, body has used the reserve in that anaerobic state, has to burn more calories now aerobically. Matlab after the workout, it has to repay the debt and pay the expense that it has incurred. Obviously, there are a lot of benefits of it. It is going to burn the fat in lesser time as compared to the normal cardio sessions that we do. It improves your cardiovascular fitness also, just not the anaerobic kind of activity. So it's not just going to increase that level of fitness, but also the cardiovascular fitness. It improves your insulin sensitivity. It increases your metabolism. Other benefits, you can do it anywhere, everywhere. You do not need any special equipments. It is very efficient, very less time consuming because 20 to 30 minutes of high intensity is more than enough for you to put into that state. Why in PCOS? It is going to bring your heart rate level up. It has this beautiful epoch effect. Normal cardio cannot do this. So, in spite of doing 1 hour of walking, 5 kilometers, 6 kilometers, it is not going to rise your heart rate level. It is not going to lose the fat level. It is going to stay there. It is going to increase your cardiac capacity definitely. But the effect, the good effects, the benefits of it is much more higher than compared to normal cardio activity. And the second, if you compare, cardio is only going to burn calories when you are doing the workout. Whereas in HIIT, you are also going to burn calories when you are not doing the work to incur the debt. It is just one small thing that I have made it for beginners. And the last thing is yoga and meditation. As we talked about the stress hormone, the cortisol hormones, which increases because as a symptom, as a sign of PCOS, because of several factors which can be there as a reason. Yoga and meditation is going to help reduce this cortisol, all right, which will keep the PCOS symptoms at bay. So the take home message over here is just get started. Try, if you're not doing anything, at least start something. If you're doing something, go talk to a professional and maybe take a good balanced diet. Talk about how the lifestyle changes have to be done, what kind of exercise has to be started, how exercises has to be started, how many days a week, how can you keep that as a long term goal. So find a form of exercise which you enjoy and it is going to be sustainable. Now, another beauty about HIIT is that it can be incorporated in any form of activity. It is not necessarily floor. It can be done in Zumba, it can be done in cycling, it can be done in dancing. It is just that the timing is important over here. So 20 seconds of activity, 10 seconds of rest. 20 seconds of activity, 10 seconds of rest. That is what is HIIT. You need to go and do a lot of research what exactly HIIT means because we have very limited time to explain you the entire thing in detail. You can add 2 days of strength training, 1 day of yoga, meditation, or any relaxation technique just for recovery. Again, depending upon the individual, you can definitely modify. Okay, so the take home message is very clear. You have to, for women who have PCOS, it is just you need to learn your own body, learn about your own body. So the more you learn about yourself, the higher the chance, the better you will emerge out of it. All right, rather than someone else telling you what you're supposed to do for your body, learn about your symptoms, be more informed about it, and then work with a nice trained professional team and just get your body in that right direction. So it's okay to be vulnerable at this point of level, at this point of time when you are having PCOS. So you embrace your vulnerabilities by learning about them, but harness them, use these vulnerabilities and recruit them to work for you and empower you. So this is what I would suggest any woman who has PCOS to go through the entire process that is happening in the body and use them in the right direction. That is it. I end up my session and thank you very much.
Thank you so much, ma'am, for such an informative and useful session on the importance of exercises in PCOS. Thank you so much. We are grateful to have you with us. Thank you so
Thank
much, ma'am.
you, Dr. Sonal. Thank you. It was a pleasure from my side too.
Okay.
So we wind up.
Yes, ma'am.
All right. See you then. Take care.
Okay. Thank you, ma'am. You too.